Hello future parents, today's video is all dedicated to the cesarean birth, and whether if you're planning a cesarean or whether if you're planning a vaginal birth, it's very important that you watch this video until the end because life is unpredictable, so you'll never know if cesarean birth is what you require at some point, so please be informed either or. Let's start. Welcome back to my channel. My name is Ilenia and I'm a midwife with a passion for education and empowerment throughout your pregnancy, birth and postpartum journey. I currently work and live in the United Kingdom, and today I'm going to discuss with you all about the cesarean birth. First thing that you're going to notice is that I really try hard to call the cesarean as a cesarean birth and not as a C-section, because I really think that the revolution starts with the word that we use to address something, and by calling these a cesarean section, I really think that it drives the attention and the focus on the actual surgical procedure rather than the birth. And instead, by calling a cesarean birth, we really highlight how this is a birth, regardless if it is via abdominal surgery or via vaginal exit. So it's still a birth, and so it should be called. A cesarean is a life-saving procedure for mother and babies, and we are so thankful that in the 21st century we can have access in developed countries to safe and sterile C-sections that can really improve maternal and fetal outcomes, that have reduced the maternal and neonatal mortality dramatically over the past decades. That being said, I'm also aware that the cesarean birth has been a little bit overused over the past years, and we have some countries in Europe that have really high percentages. We can actually have a look of some percentages through the perinatal health report that was done in 2015. I think a new one is coming soon, but until then, those are the last percentages that we have available in the European Union. So we have a lot of countries that are doing a good job, with the cesarean section rate being low as 16-17%. I'm talking about the Netherlands, Norway, Finland. 20% is France, 19% Estonia, Belgium 21%, and then we have other countries with very high percentages, such as Cyprus, I think is the highest, is 57%, and then we have Bulgaria 43%, Poland 42%, Italy 35%, 35.4%, Ireland 34%, Switzerland 34%, so yeah, I would say they range between 16% to 40-45%, so some countries have it way above the recommended percentages from the World Health Organization, so really be cautious about the indication of a cesarean birth. If you have an elective cesarean birth, make sure that if you have one because you had a previous cesarean birth, make sure you have been informed about risks and benefits of having another cesarean birth rather than a VBAC, a vaginal birth after cesarean section. And also always discuss with your provider about the benefits of this procedure if that comes across your situation at some point during your pregnancy or during labor. To link me with this statement, I want to say we can divide the reasons for a cesarean section in two main categories, being an elective cesarean birth or a urgent cesarean birth. The urgent categories can be divided in emergent, category 2, 3, 4, it's a bit more complicated than that, but to simplify it, let's say a cesarean birth that is urgent is usually done during labor because of fetal distress, because of placenta rupture, because of failure to progress, meaning that your labor has not been progressing for a while, or maybe is done urgently before labor because of a situation that has occurred, or then if it's done elective, it means that has been booked, has been programmed, and you know you have a date for your birth and you know exactly when is it gonna happen. Regardless whether if you're planning a cesarean birth or not, it's very important that you have a broadly understanding about how this procedure is done and the preparation that this procedure requires, because life as pregnancy and birth is unpredictable. So also by looking at the percentages in Europe, we can notice that this might be an option that presents to you at some point during your pregnancy or during your labor. So it's very important that in order to have a beautiful birth experience, regardless of your mode of birth, that you know and you're aware what is involved during this procedure. So let's go and see what needs to be done to prepare for a cesarean birth. Is actually not much. If you're planning a cesarean birth, then the night before you're gonna be asked to have dinner and then stop eating from midnight in order to have your stomach empty, and to drink clear fluids, meaning water, plain tea, apple juice, until 2-3 hours before the surgery. This is because we want your stomach to be absolutely empty and to prevent food aspiration into your lungs if you feel unwell during the surgery. In order to prevent this, you're also going to be given the morning of your surgery anti-acid medication, usually in the form of a tablet or a syrup to drink. You're not required to shave prior to your cesarean birth. I hope that you're not being told to do that. The day of your birth, the midwife or the nurse is going to help you to shave the bikini area. This is where the incision is going to be, but you don't need to have all the pubic area shaved. That's all in terms of preparation. The day of your birth, you're going to be admitted in the hospital. Then you're going to be greeted by the midwife. She's going to check you up, check the position of the baby, check the baby heart rate, make sure that everything is okay. You are going to have an IV line placed either before the surgery or in the operating theater in order to have a quick access to your bloodstream in case you require fluids. You're going to require antibiotics during the surgery, and maybe you require a particular medication. So it's very important to have an IV access ready and functioning. You're gonna be given some compression stockings to wear in order to prevent blood clots, to reduce the risk at the minimum, and you're gonna require to wear them also during your postpartum period. You're gonna meet the doctor that is gonna perform your surgery, if you've not done so already. He or she is gonna go through with you what happens during the surgery and what risks and what complications can happen, and you're gonna require to sign a consent, meaning that you're gonna sign that you understand the risk involved in the procedure. After that, you're gonna be moved into the operating theater when the time comes to your surgery. Usually the elective sections are done in the morning. Please bear in mind that if there are a lot of emergencies going on during that day, your surgery might be pushed a little bit, but usually they're done in the morning, also because we know that you're fasting. So you're gonna be greeted in the operating theater. You're gonna see a lot of people, the anesthetists, the nurse, the midwife, sometimes the pediatrician. There are gonna be a few people in the room, and the room is gonna be bright and a little bit cold. Cold because we want to reduce at the minimum the risk of infection, so the growth of bacteria, and that they don't grow as quick in a cold and chiller environment. And then it's bright because we need to see what's going on. You're gonna be asked to sit on the operating table to have your anesthesia placed. Generally, if it's an elective, mostly actually, if it's an elective section, then you're gonna have a spinal inserted, meaning a needle that is gonna go into your back, a medication is gonna push through it, and then you're gonna feel numb from below the breast down. If it is an emergency section or an urgent section, if you have an epidural because you are in labor and you have an epidural placed, then usually if it's a working while epidural, the anesthetist can use that one to top up your anesthesia for the surgery. Otherwise, if it's a very emergent section that your life or the baby's life is at risk, then you're gonna be put to sleep with a general anesthesia. But generally speaking, we try to avoid that because the recovery is a little bit hard. So in the scenario that is a real emergency, be aware that you might be put to sleep. After the anesthesia is placed, the midwife is going to insert a urinary catheter into your bladder because we want the bladder to be empty. You're not going to be able to control it during the section, and also because we want it to be out of the way in order for it not to be nicked out by accident during the surgery. Your partner is going to be asked to come in at this point if he's not there with you already, and it's going to be at your side during the surgery, so ready to greet the baby there when he or she comes out. The procedure itself, it's quite quick. You are gonna be in the operating room for 45-60 minutes in total. Baby comes out usually after 5-10 minutes from the start of the cesarean birth. You're gonna be able to see your baby. They're gonna lower the drape for you in order for you to see the baby while they do the leg cord clamping. Please make sure that you ask that the leg cord clamping is done although you're having cesarean birth. For the leg cord clamping, I mean that a little bit of time is given for the blood to be transferred from the placenta to your baby through the umbilical cord, and therefore the cord needs to be left intact for this transfer to happen. After that, the baby is gonna be brought to the midwife or to the neonatologist, according to the needs of your baby and whether this was an elective section or not. After that, ask for your baby to be brought back to you straight away to commence the skin to skin. Skin to skin can be started in the theater with you. If you don't feel well or if it's a little bit too cold, maybe skin to skin is gonna be done by your birth partner, but it's very important that this commence as soon as possible. If you're not in the condition to do so, please do commence it as soon as you come out of theater. Make sure to discuss your wishes with your provider if you are planning an elective section, not because you're gonna have a belly birth, as we said, your rights are not gonna be respected. You can ask to have a gentle cesarean birth, meaning that you can have music played in theater, you can use a bit of aromatherapy or hypnobirthing if you wish, you can have the leg cord clamping as we said, you can have early skin to skin and maybe breastfeeding initiation, you can ask to have your drape lower down if you want to see your baby being born. There are a lot of options for you and you should be listened to and you are allowed to these options. So make sure that you ask to your provider, regardless if it's an elective section or an urgent section. If baby comes out in good condition, you can have all these things anyway. That's all for this video. I hope that it was helpful for you to have an idea about what happens if you have a cesarean birth and what are your rights and what can you ask in order to have the best experience possible. If you've not done so already, please like the video and subscribe to the channel. I'll see you next video. Bye bye!